Hello, I'm Philip Clark and I'm the Director of the Health Economics Research Centre at the University of Oxford. In this short video, we'll provide an overview of HERC and as well as the types of research we do and teaching activities we undertake. HERC started in 1996 by our Foundation Director, Professor Alistair Gray. Over the last 20 years, it has grown to an organisation of over 30 researchers and around half a dozen PhD students. I took over as Director in early 2019. HERC aims really to improve the health of nations, as it were. We do this by trying to improve both the efficiency and equity of healthcare systems. In terms of our research, we cover a very wide variety of research topics and methodologies. In terms of the types of methods we use, we look at valuing outcomes as well as trying to quantify costs. We bring these together in trying to allocate resources by using techniques such as cost-effectiveness analysis to evaluate different interventions, and we work across a wide range of diseases, including chronic diseases such as cardiovascular disease and renal disease, and as well as other diseases such as cancer and infectious diseases, and as well as looking at genetics and the implications of new technologies. Our funding comes from a wide variety of different sources. This includes funding at a national level, such as the National Institute of Health Research, as well as private charities such as the Wellcome Trust, and includes some international funding.
Together with my colleagues, Bobby Mikhailova and Claire Simons, we used patient-level data from large clinical trials and routinely collected health data to develop models that could be used for evaluation of the long-term effects and cost-effectiveness of interventions. An example of our research is work in chronic kidney disease that was developed in collaboration with the department's Clinical Trial Service Unit, in which we used data from a clinical trial to build a model that could predict patients' chronic kidney disease progression, cardiovascular complications, healthcare costs, and length and quality of life. This model was published together with a web interface so that other policymakers and researchers could use it for future research. We recently used the work to show that cholesterol-lowering interventions such as statins are cost-effective in chronic kidney disease patients.
Together with several colleagues at HERC, I have been working on various projects related to economics and antimicrobial resistance. As widespread use of antibiotics increases, bacteria are becoming increasingly resistant to antibiotic treatment, and because of this, the existence of effective antibiotics is under threat. This is a serious global problem, and pressure is mounting to get commitments to tackle the problem at an international level. In a paper published in Science, we have discussed the many similarities between the challenges posed by climate change and antibiotic resistance, and described solutions to the key economic issues. These range from incentivizing the development of new antibiotics to improving antibiotic stewardship through better regulation and better financial mechanisms.
HERC has a range of teaching activities at the undergraduate, postgraduate and professional level. These include the internationally renowned 3-day course in the Advanced Methods of Cost-Effectiveness Analysis and a day course in Introduction to Health Economic Evaluation. These courses have been attended by more than 1,000 professionals from different academic backgrounds, sectors and countries around the world in the last 20 years. We also contribute to the MSc Global Health Science and Epidemiology MSc program by providing a module in health economics. For enrolled students to the Medical Studies program at the University of Oxford, we provide introductory lectures in health economics. Supervision of doctoral students has been a core activity at HERC since the centre was established in 1996.
I'm currently a first-year DPU student at HERC. So my work is on developing a framework to model outcomes in diabetes patients, and is supervised by Bobby Mihalova and Jose Liu at HERC, as well as Luis Bowman at the Clinical Trial Service Unit. So one of the benefits of working within HERC is that the unit has long-standing expertise in the area of disease modeling, as well as conducting analysis alongside clinical trials. I also get the opportunity to work with really outstanding epidemiologists and clinicians from across the department, and I also get access to really good quality data sets here. So in my case, my work is based on the data from the ASCEND trial, which is one of the largest diabetes trials conducted by the Clinical Trial Service Unit here in Oxford. So in terms of personal development, the department as well as the division offers a range of training activities. There are also opportunities to sit into the different seminars within HERC and within the department that actually exposes you to a range of different research areas in population health.